patient here who's not responding very well. Sir, sir. This guy looks to be altered, Si.
Yeah?
I think we need to run through our criteria. O2 glucose pump sits.
What's that?
Well, we've got to check all of those different things to make sure that we can rule out any possible problems that this guy may have. So let's start with the O2. Put the O2 monitor on his finger.
All right.
Zach, will you go look for some drugs or anything, medications you could find laying around the house somewhere?
Sure, I'll do that, Andy.
Thanks. So while we're doing that, I'm going to keep trying to get him responsive. Sir? So we're checking the O2 right now. Si's getting a set of vitals. We're going to check his pump here in a little bit. So Si, if you can hand me before that, we'll get that started. After, check his blood glucose. Patient appears to be breathing okay. So, Si, what are some of the other things we need to look at besides the glucose and the pump and the O2s?
Well, I think you mentioned something about SITS. What does that mean?
Okay, SITS. That's our standard for looking at if he had any trauma or if he had any infections. You know, we'll get there.
All right. Oxygen saturation is at 100%, so we got
Sweet.
an O2 out of the way.
Sharps on the table.
Okay.
Get some blood. Why don't you go ahead and, you got the 4 lead going on there?
I got the 4 lead going.
Okay. So what are you seeing on there?
It looks like a normal sinus rhythm. I see no ectopy or anything at 65 a minute.
All right. Good. So let's go to our SITS portion. First S in SITS stands for structural. So let's look for any signs of trauma
Okay.
to the head area.
Let's see. I'm going to do a quick head-to-toe assessment. I see no bumps, bruises, or bleeding. Ears are clear.
Blood glucose is 100.
100, so that's normal.
Okay.
Checking his eyes. Equal reactive. No blood or fluids coming from his nose or mouth. I'm going to expose him really quick. No discoloration, no bleeding. Everything feels stable. Checking his hips.
I'm checking his back to see if
Pelvis.
there's anything back here. I don't feel anything.
Lower extremities, we're clear. I don't see any trauma.
Okay, he's got a good pulse. So let's move to our next piece of criteria, which is the I, which stands for infection.
Infection. Okay.
So we would want to get a temperature on this guy. Where's our temperature?
Simulate.
He doesn't feel very warm. Does he feel
Yeah,
warm
it
to
feels
you?
fine. And get an
Okay.
oral temperature.
98.6.
98.6.
Sweet.
So no fever.
Love it. Okay. So I don't see any other signs. We don't know if he has any kind of infection like a UTI or anything like that because he's not responsive and there's nothing around here.
Do you think Zach has got the medication?
Maybe.
Hey guys, I happen to have found his medication list, and it appears he was taking Dilantin.
Dilantin. What does that do?
That's a seizure medication.
Seizure med. This could possibly be a seizure.
Well, let's keep going through our criteria to make sure
Okay.
to rule everything else out. So the T stands for toxins. So let's think about this for a second. Toxins is you, me, and Andy. So, the U portion. Is there anything that this person could have had that the doctor gave him that we don't have any other medications, do we, Zach?
It just showed Dilantin, huh?
Yeah, but no other medications. So we
Okay.
can rule
No,
that out.
I couldn't find any other medications.
Outstanding. So,
I don't see any pills or illicit use of drugs or alcohol lying around.
So that would eliminate the me portion. And we have no idea if he has an endocrine problem because there are no drugs and he's not talking to us. So then the next portion would be the S, which is seizure psyche.
Seizure psyche.
And we
How do we
already-
check for that if he's...
We already discovered, Zach already discovered actually, that we have a seizure medication.
Okay.
And he seems to be moving around a little bit. Sir!
I don't see any incontinence.
Sir!
You coming
Hey.
around?
I don't know.
What happened? Do you remember what happened?
I don't know. What? I think I had a seizure.
Oh,
Interesting. I have a history of seizures.
okay. That's good to know.
Bingo.